Autism or Autism Spectrum Disorder, ASD, is a complex neurobiological developmental disorder that affects a person's functioning in several ways. The term spectrum is used because the characteristics and severity of symptoms can vary widely. To gain a deeper understanding of ASD, we will explore several aspects including its characteristics, neurobiological basis, genetic factors, environmental influences, diagnostic methods, and impact on daily life. Characteristics of autism. 1. Communication problems. Verbal communication. Some people with autism have difficulty learning to speak or don't speak at all, while others can speak well but have problems with pragmatic aspects of language, such as taking turns in conversations, interpreting nonverbal cues, or understanding sarcasm and imagery. Nonverbal communication. This can include issues such as limited eye contact, facial expressions, gestures, and body language that are difficult to interpret. 2. Social interactions. Difficulty making and maintaining friendships. Problems understanding social norms and expectations. Limited interest in peers and sometimes a preference for solitary activities. 3. Repetitive behavior and limited interest. Stereotypical movements such as hand flapping, rocking, or turning. Strict routines and rituals and extreme anxiety when interrupted. Intensive and limited interests, for example, a deep fascination with a specific subject or object. 4. Sensory sensitivities, over or under sensitivity to sensory stimuli, such as sounds, smells, light, and tastes. Neurobiological basis of ASD. 1. Brain structure and functions. Atypical brain development. Research points to differences in the growth and structure of the brain in people with autism, including abnormalities in the amygdala, hippocampus, and frontal cortex. These areas are involved in emotion, memory, and decision-making. Connections between brain areas. There is evidence that the connectivity between different brain areas is different in people with autism, which can lead to both hyper and hypoconnectivity. This affects how information is processed and integrated. 2. Neurotransmitters, dopamine and serotonin. Disruptions in the systems of these neurotransmitters have been observed in people with autism, which can affect behavior, mood, and impulse control. So what? GABA. This is the main inhibitory neurotransmitter in the brain. Changes in GABA activity may contribute to the sensory and motor abnormalities often seen in autism. Genetic factors. 1. Heredity. High heritability. Studies show that autism has a strong genetic component with an estimated heritability of 70 to 90%. This means that genetic variation plays a significant role in susceptibility to autism. Genetic mutations and syndromes. Specific genetic mutations and syndromes, such as Fragile X syndrome and Rett syndrome, are associated with an increased risk of developing autism. 2. Genome research. CNV's copy number variations. These are duplications or deletions of large pieces of DNA and are more often present in people with autism. They can influence genes involved in neural development and synaptic functions. Single nucleotide polymorphisms, SNPs. Individual genetic variants that contribute to the complexity of autism. Large genetic studies, genome-wide association studies, have identified several SNPs associated with an increased risk. Environmental influences. 1. Prenatal factors. Exposure to substances. Exposure to certain substances during pregnancy, such as Valproate, an anti-seizure drug, can increase the risk of autism. Pregnancy complications. Factors such as prematurity, low birth weight, and prenatal infections are associated with an increased risk of autism. 2. Postnatal factors. Environmental stressors. High levels of stress and trauma in early childhood may contribute to developmental problems, although their direct link to autism is still under research. Diagnostic methods. 1. Behavioral observations and clinical assessment. DSM-5 criteria, Diagnostic and Statistical Manual of Mental Disorders. Diagnostic criteria include persistent deficits in social communication and interaction, restricted repetitive patterns of behavior, interests, or activities, and symptoms that must be present in the early developmental period and cause significant impairment in functioning. These disorders are not better explained by intellectual disabilities or global developmental delays. 2. Diagnostic tools. ADIR, Autism Diagnostic Interview Revised, a structured interview with parents used to assess the child's developmental and behavioral characteristics. ADOS, Autism Diagnostic Observation Schedule, a semi-structured assessment tool that involves direct observation of the child's behavior. Impact on daily life. There is no cure for autism, but there are several treatment methods and interventions that can help. 1. Education and learning. Individualized education plans. IEPs, specially designed programs tailored to the unique learning needs of a person with autism. Inclusion, promoting participation in regular classes and activities with appropriate support. 2. Social relationships and interactions, guidance and therapies. Social skills, training, and group activities to promote social interactions. Support for families, parent courses and support groups to help families understand and tackle the challenge of autism. 3. Occupational and daily skills, occupational therapy, aimed at improving motor skills and learning daily activities. Supportive employment, programs that help people with autism find and maintain employment, adapted to their strengths and needs. Behavioral therapy, applied behavior analysis, ABA, is a commonly used method that promotes positive behaviors and reduces negative behaviors. Speech and language therapy helps develop communication skills. Medication, sometimes prescribed for additional symptoms such as anxiety, depression, or hyperactivity. Autism spectrum disorder is a heterogeneous and complex condition that requires a multidisciplinary approach to diagnosis and treatment. Many people with autism lead fulfilling lives, especially if they receive the right support. Due to the diverse nature of the disorder and the variability in symptoms, an individualized approach is essential. Continued research into the neurobiological and genetic basis of autism, along with improved diagnostic methods and treatment strategies, will contribute to better understanding and support of people with autism and their families. Never hesitate to seek help. You are not alone. Seeking help represents strength, and that is what every person has. Talk about it with someone you trust. Thanks for watching this video. Did you find this an educational and interesting video? Don't forget to give it a thumbs up and subscribe. See you again in the next video.